learned from, oh, great. Lessons learned from cohort one. Before I jump into our content for the day, I do, as was said, I have multiple of my colleagues here. Our evaluation is definitely a team effort. I am here today really as a messenger. We collaborate very closely with folks in the state of New Jersey and multiple colleagues here at Johns Hopkins. So I wanted to just pause and give the opportunity for folks to introduce themselves. I don't know if Sarah from DOH was able to join. Sarah, if you are here, do you want to introduce yourself? Okay. Jill, can I put you on the spot to introduce yourself?
Sure, you can. Good afternoon. I am Jill Brown. I am the Home Visiting Program Director here in New Jersey within our Office of Early Childhood Services. Thank you.
Awesome. Thanks for joining, Jill. And Alex, I don't know if you want to introduce yourself. Electricity.
Sure. Hi, everybody. My name is Alex. I'm a senior research data analyst at Johns Hopkins. And I've been working on these New Jersey home visiting projects for about 5 years now. Thank you so much for having us today.
Anything. Awesome. Thanks, Alex. Okay, so I will jump in. And one thing I just want to say right off the bat, we're really excited to be here today. And I would just say that as we're presenting here, if you have any questions, if you have any reactions, please feel free to share. We're very open to your feedback and your reactions. So anyway, I just wanted to throw that out there. I have my chat open. Also, feel free to come off mute. I have a couple opportunities for just kind of pausing and reflecting during the presentation. So this just gives you an overview of what we'll walk through today. First, knowing that y'all are in Oklahoma and you may not be familiar with our context, we wanted to share a couple of pieces of our context just to help you better understand our work. And then we'll talk through two of our questions from our evaluation. And we want to talk really about our methods and our findings and lessons learned in both, because there's a lot to learn when it comes to workforce. And then very briefly at the end, we'll just talk about our ongoing work. We're still focused in workforce, so I'll talk about our next steps in this area. So to talk a little bit about New Jersey's network. So New Jersey has 64 home visiting programs. They are run by 26 agencies. And in New Jersey, home visiting is jointly managed by Department of Health and Department of Children and Families. And there are three primary home visiting models implemented through this collaboration. That's Healthy Families America, Nurse Family Partnership, and Parents as Teachers. All three of these models are offered statewide. And then just to give you a sense of kind of the size of our workforce, there are more than 200 home visitors working in New Jersey. There are more than 45 home visiting supervisors. And then we just wanted to give you some context as to who our home visitors are. We have some basic demographic characteristics here. The average age is about 40 among our home visitors, with a pretty wide age range, really. Just over half of our home visitors identify as Hispanic or Latine. Our home visitors speak many, many languages. That includes Haitian Creole, Portuguese, Spanish. About half have a bachelor's degree. And then there's a wide range of years of experience. We have home visitors with up to 30 years of experience in the New Jersey network. The average, though, is about 5.5 years of experience. We also wanted to give some context about evaluation in New Jersey. So David kind of alluded to this earlier, but New Jersey started doing evaluation of home visiting early in the early 2010s. So it's been many years of evaluation already. And in that time, New Jersey has discovered, like, really done some learning in a lot of different areas, including things like service tailoring, also really looking at the connection between central intake and home visiting. Um, and then more recently, we have been participating in the coordinated state evaluation. So the work started in 2021, and it just wrapped up. Well, the funding just wrapped up, I should say, like 2 weeks ago. So it was a 4-year journey. And it was really having that 4-year time frame was great because it gave us the opportunity to be a kind of more collaborative than we had been in the past, and more participatory than we had been in the past. And I'll talk about that a little bit in this presentation. It also gave us the opportunity to collaborate with peer states. We learned so much from our peer states in cohort one. I'll allude to some of that in this presentation as well. Um, One major piece of context for all of this, New Jersey has done home visiting research and evaluation for a long time. We had never focused on our workforce before. So we were very new to how do we measure the well-being of our workforce? How do we think about these key issues related to our workforce? So just emphasizing, like, we were babies coming into this work. We had a lot of learning over the last 4 years. And that's a lot of what we're sharing today. So lots of learning to do. And then these are the questions that I'll talk about today. So just two. As you'll imagine, with a 4-year project, we didn't just address these two questions, but we wanted to put together something manageable for today. So we'll focus on these two questions. And with that, I want to jump into our first question. So this really considered how the well-being of staff and the climate of organizations relate to staff retention. So, like I said, this was the first time we had considered well-being. We wanted to be really careful about doing primary data collection. We were open to doing a new survey, but we wanted to leverage existing data, so that we were taking a thoughtful approach in all of this. So we used data from a 2017 survey, as well as our home visiting program data. And our outcome of interest, we're wondering about staff retention. How do you define staff retention? It's funny because at the face of it, it seems very obvious, or I should say really simple. We learned our lesson. It's not very simple, and I'm sure all of you can understand the nuance and complexity of staff retention. But one of the things I was talking about earlier is how we tried to take a very participatory approach in everything we did in this evaluation. So when it came to defining what is staff retention, we had a lot of discussion with our state partners, Jill and Sarah, and others, and then also with supervisors themselves. And I want to share this. This may seem really random to you, but we wanted to have, a detailed, robust conversation about retention. And we wanted, though, to give people specific things to react to. So in our meeting with supervisors, we presented different scenarios. All credit for this goes to my colleague Alex, who's on the call. But, we created these scenarios. So this is one specific example where we see Genesis hired as a home visitor. Genesis gets promoted to a supervisor position, but keeps a small caseload. And then at the end of this time period, this observation period, Genesis is still employed as a supervisor with a caseload. So we basically, in conversation with supervisors, we went through these situations and we asked people, according to you, like, do you think this is staff retention? So we went through a bunch of scenarios like this. and arrived at our staff retention definition. So we basically decided as a group that staff retention is when a home visitor remains employed in home visiting with the same agency, even if they are promoted to a supervisory role or if they transfer from one county to another. So as long as they're with the same agency, still working in home visiting, we consider them retained. So I just want to emphasize, this is the definition we came up with for New Jersey. This was what people could agree to. You may, y'all are in Oklahoma. You may have a different thought of what this should look like, but I just want to emphasize that's what we mean when I say staff retention. So before I get to our results, I just wanted to explain our sources of information here. So on the left-hand side, you see what we got from our survey. So we got years of prior experience in home visiting. Home visitors were asked if they intended to leave their job. We asked about depressive symptoms. And then we asked about these three aspects of the organizational climate. So we asked about stress, we asked engagement, and then we asked functionality. And then on the right-hand side, you'll see the information that we got from the home visiting program data. So from those data, Alex was able to find dates of role changes. So when people either were promoted or they shifted counties that they worked in. Also in those data we had the dates when people ended their employment with their agency. So to analyze all this and to gather our findings, we conducted survival analysis to think about, of these factors, these 6 factors, which ones were related to retention. So this is what we found. So first, we looked at just over 5 years. And when we considered 5 years, just less than half of home visitors were retained for that time period. And then in the table here, we just outline whether each factor was associated with a staff person staying or if it was associated with them leaving, turnover. And we use these icons. This again is thanks to Alex and her creative depiction of results. But I can just walk through this quickly. So just to give you the visual or the verbal interpretation, when home visitors have more years of experience, they're more likely to be retained, they're more likely to remain in their job. When home visitors intend to leave, they are more likely to leave. With depressive symptoms, we did not find a significant relationship to either staying or going. With stress, we found this, you'll notice that this icon is small and gray. This is a marginal association. The p-value is 0.05, right on the money. So this was kind of interesting to us and a bit surprising really for our team. The idea that stress seemed to be marginally associated with retention, with people staying. Engagement, we did not see significant associations. And then functionality. Here we did see that when home visitors reported greater functionality in their home visiting program, they were more likely to stay. And I know this is a lot. The measure that we used is a bit confusing and has a lot of elements, but you'll see that functionality includes role clarity, cooperation, and opportunities for growth and achievement.
And you have a question in the chat.
Oh, yeah. Thank you so much. Who identified the 5-year time frame as retention? So what I will say, we looked at 5 years. People did not have to stay for 5 years. So what I'll say is like this stat at the top of the slide, this is, at the end of 5 years. 44% of home visitors were still at their agency. This analysis, though, down here counts everyone who stayed and left. And it's just looking at, like, is this factor related to whether people stay or leave? That's a great question. We wanted to take a long horizon because we know that training new home visitors, hiring new home visitors takes a lot of time and effort. And yeah, so we wanted to have the longest observation period we could. That's a good question. So I just wanted to talk briefly about our lessons learned here. And then I wanted to just pause if there are other questions, other reactions to this. In terms of our methods, lessons learned, staff retention is really complicated. When we talked with supervisors about staff retention, we talked about these, like, there are varying perspectives on whether staff are retained or not. Like, the family might have one experience of staff retention, whereas the supervisor and program manager could have a very different perspective on staff retention. So that's definitely something important to consider. And, I would just emphasize the importance of collaborating with supervisors, with program staff to really build the staff retention definition. We found a lot of value in doing that as a group. And then our findings here from the survival analysis, basically, like, when home visitors report greater program functionality, they're more likely to stay. Those with more prior experience are more likely to stay. And then basically those who intend to leave are more likely to leave, which is probably not surprising. But yeah, so I wanted to pause here for a couple of minutes. I know we don't have that much time, but if people have any other questions or observations, we'd welcome that. I know this is also, like, a lot of information. It's like a speed tour. Yeah.
Well, I'll take advantage of the question window here. Are you surprised by the finding that engagement did not predict, but functionality did? Any theories as to why engagement was not a stronger influencer? Am I misinterpreting the graphic? Maybe I'm misinterpreting.
No, you're right on. Engagement is not, it's not associated with leaving or staying. It's yeah, it seems to not matter. At least in our sample in this context. Yeah, no, it's interesting. I mean, I don't know. I think prior work, the tool that we used was the OSC, and I think prior work with the OSC had shown that engagement mattered. Yeah, so maybe it's slightly surprising, but I think we were more kind of struck by the stress finding. But yeah, I don't know if Alex or Jill have any thoughts on that. Okay.
So the implications for me would be that if we're going to focus on something to improve retention, engagement is not necessarily the key as much as role clarity, cooperation, opportunities for growth and achievement.
Yeah.
Natalia, Natalia, would you like to come off mute and ask your question?
Yes, and I actually don't have a question. It's more of an observation. I just find it really interesting that you said if they had prior home visiting experience, that kind of got them to stay longer and continue with their job. In my agency specifically, I've been here for almost 11 years, and we've had, surprisingly, a lot of childcare workers or people in the field of childcare come over to home visiting, and we've had really great retention with them. So it's really interesting how they've come from nothing in that background in home visiting and hadn't maybe a little bit with social services and referrals and stuff like that. And so I just thought that was really interesting, that was a big indicator. And even our program manager didn't come from home visiting, and she's been here for over a decade too. So that was just something that I noticed that's different in our states or different regions. And then with the depressive symptoms, that is very interesting to me as well because I am a program supervisor here and we oversee parents as teachers. And we have staff who've been very open with their mental health and things like that. And they will say they're just like, I my issues come from my home, my family life, but it has nothing to do with work. When I come to work, that's when I feel like I know what I'm doing. I love this. This brings me joy. And so it is very interesting that that wasn't a big indicator because we found that as well. They're very much like, I would rather be at home, at work instead of stuck at home dealing with my personal life stuff. So that might be a little bit too TMI, but I just thought that was interesting that that came up for you guys as well. So I just wanted to share so we could kind of compare differences or
Yeah.
whatever.
No, I super appreciate that. No, thank you for sharing your observations. Yeah, I think I take your point. You know what? Maybe it doesn't even need to be home visiting experience, but like prior experience in these types of professions. We used home visiting experience. This is what we had. This is what we knew. But yeah, I think that's a great point. And depressive symptoms are, I don't know. You all know this. Depression is really complicated, and it can come, it can go. So it's hard to know exactly what to do with this. This is from the CESD-10, which you may actually use in your programs to screen families, but it's a short look back period. So it's not necessarily speaking to like longer experiences of depression or not. So yeah, it's complicated. Cool. But no, thank you for sharing your reactions. I appreciate that. I think I should move on because I'm like very much going to go over time. All right, sorry. But please share other reactions in the chat if you would like. So, and then the second question we wanted to talk about was just what supports that are provided to staff are related to job satisfaction. So basically, we learned a bunch of things from our prior survey work. So we wanted to plan a survey for 2023. So we collaboratively designed our survey with our advisory group of home visitors. The home visitors who advised on our survey development really wanted us to ask about flexible work schedules. This was very important to them. A couple of them in particular just spoke to the fact that having like a flexible work schedule really helped them to stay in their job. So in our survey, we asked about a lot of different things. But what I'll talk about today is, we asked about job satisfaction, flexible work schedules. We also ask about benefits. And one thing I want to point out, our colleagues in Oregon, when they did a survey of their home visiting staff, they periodically throughout the survey had open-ended questions, just to be able, so that people could kind of explain their responses a bit more. And we kind of borrowed that strategy from them. And I just want to speak to the value of that because I'll use some quotes from those open-ended questions later on. I was talking earlier about being able to be more collaborative. We had more time to do this evaluation, so we had more time to plan it. We also had more time to interpret our data. So we did a couple of data walks with our survey data, one with supervisors, one with home visitors. This was a really cool experience. We did some very basic analysis of the survey, and then with the data walk, people had Post-it notes, and they could kind of walk around and share their thoughts on the data, their questions. So that was really valuable for us. So I wanted to share a couple of findings in this area. So flexible work schedules. We asked people about this in a section of the survey. Here you see some of the items we asked, not all of them, but just to give examples, like I can start and end my workday at different times of day. I can schedule clients on weekends. We found no relationship between these items and job satisfaction. And when we saw that initially, we were surprised. But then we did the data walk. And in the data walk, we got a lot of really good feedback. And it was all over the map. Here at the bottom of the slide, we give two examples of kind of these like different ends of the spectrum. But the first home visitor says, I'm surprised people want to work evenings and weekends. I chose this position because I wasn't required to do either. And then in sort of an opposing view, we have another home visitor who says, I value flexibility because I'm a single mom. There's not many workplaces that offer as much flexibility as home visitation. So this was very interesting to us. And then it kind of, I'll talk about it later, but this kind of shaped how we think about asking about benefits. Because here we just, these question wordings all say, I can. So we'll talk about that more in a second. So we talked about flexible work schedules. We also asked about benefits. So these questions we had borrowed, we do a lot of borrowing from Oregon. So these questions had actually come from Oregon. But first, for each benefit, people were asked, do you have this available to you? And then secondly, if it was available, they were asked, are you satisfied with this benefit? So we asked about the benefits included in this list here. When we consider the availability of benefits, it was only health insurance that was related to job satisfaction. When we look at satisfaction with the benefits, though, we see that many more of these benefits are related to job satisfaction. So this is a graph to kind of like visually depict that, but I think the most important thing here is this context of, health insurance may be available through the home visiting agency, but depending on the costs of the health insurance, can they even use it? So we got a lot of, and these are actually like open-ended comments from our survey, because we gave the opportunity, there was like an open text box beneath this question. So people just provided really valuable context as to why they replied in certain ways on the survey. So as I was just saying, the open-ended questions were really valuable. And as I was alluding to earlier, when we think about supports that are available to home visitors, to supervisors, just really the importance of thinking about how we ask about these things. Like for example, with the flexible work schedules, a lot of people don't even want a flexible work schedule. So if that benefit or that flexibility is available to them, it doesn't matter to them. So I think, as we keep going in this workforce direction, we're thinking a lot about how we ask questions so that we can really gauge, what's available, what do people utilize, what are people satisfied with. It's not just yes, no, is this available to you? And we saw that the flexible work schedules were not related to job satisfaction, but it was really the availability of the flexible work schedules. And then we also see that it's really like satisfaction with benefits, not just their availability, that is more important for job satisfaction. So I'll pause here. I know I'm already a little over time, but if anyone has any questions about that or reactions.
Okay, again, I'll take advantage of the window. Interesting findings again. The earlier result, if you could go back a slide or two, with the can wording on those items. The other thing I wondered is, how many of these agencies or programs were restrictive with flexibility? And is it possible that, you're not seeing an association here between their response to their perceived flexibility or their actual realized flexibility? But if somebody needed flexibility, was trapped in an agency where they didn't offer it, is that where we would see a relationship?
Yeah, it's a good question. So this was in the survey, we only asked home visitors. We didn't get the perspectives because it wasn't our research plan. But yeah, no, I think it's a great point. And then you also have the fact that like some supervisors, they might provide flexibility in and of themselves, regardless of what agency policy is. So I think there's a lot of things to take into account when it comes to like agency policy, what is actually provided to people and what people are looking for.
In New Jersey, are the policies highly variable? Do some agencies provide these visits on the weekends, others
Yeah.
do not? Okay.
Yeah, because and I get it. Like, I mean, it becomes depending on the home visiting model, it becomes a supervision challenge. Because depending on the model, supervisors also have to be available on the weekend if home visitors are administering home visits on the weekend. So it just becomes a lot to think about and a lot to plan. So.
This is Yolanda with Parents and Teachers here in Oklahoma City Public Schools, but we kind of work around flexible schedule, and it's more for families than for us per se, because I mean if you have a parent that that need the visits a little bit later, we try to accommodate that, and of course parent educators somehow they also take advantage of that flexible schedule. But for example, in the weekends, there were a couple of educators that they said that they could do it. And there were families, they also said they could do it if it works for them. But we end and, like, I think every time they were scheduled something with a couple of families, there were not too many, they ended canceling because they got too busy during the weekends. And after that, there was no, I mean, I think that maybe it was one or twice. And after that, I was like, no, I mean, I thought this is going to work, but this is the only time that we have free. So, I mean, even if the educator was willing to do some Saturday visit. So,
Yeah. Yeah. No, that's important to consider because I think it also like when people have flexible schedules, it can also be very hard to maintain a work-life balance. So, there's definitely like a push-pull with flexibility. So because I think some people really appreciate it, others then struggle to maintain balance between work and life. So yeah. Cool. Well, let me I think we just have. So just wanting to explain that, in cohort one, we really focused on home visitors. And one of the things that we saw in our survey and heard in our data walk is that the support of supervisors is essential to the home visitors. The home visitors value supervisor support so, so much. And so that made us want to know more about supervisors. How are supervisors doing? Because if they're a key support for the home visitors, we want to make sure that they're doing well, they can provide good support, and they can be, they can experience well-being in their own positions. In New Jersey, we don't really know very much about the well-being of supervisors, the supports that are provided to supervisors. So our cohort 2 goal is really to learn more about their well-being and to learn more about the supports that are provided to supervisors. And I think with that, oh yeah, just wanted to say thank you. We really appreciated the invitation, and also just a thank you to all of our partners in New Jersey, our home visitor supervisors, all of our different partners.
All right. Thank you so much, Anne. That was all really interesting, and I think we're going to benefit a lot from your experience as we work with you in the cohort 2 and share some goals. And thank you for those from New Jersey who joined our meeting as well. We appreciate you being here. Uh, there were a couple other things left on the agenda. I had something on the agenda about talking about proposed changes to ETO that 3 of your agencies had come up with. There's like a 2-page document. I think I'm going to hold off talking about that until after they do their presentations at the learning session, because I don't want to steal anyone's thunder. And so, David, would you like to talk to us about the learning session plans and innovation sustainment?
Yes, happy to do that. Let me reiterate, thank you to Anne and the New Jersey folks for coming. Totally within the spirit of our learning collaborative, learn from one another, learn from others outside the state. We often reference your work, and it's great to sort of, again, hear it directly from those who have gathered these data and these findings. I wanted to give everybody a preview of the learning session, and yes, time flies. We are ready for another in-person learning session next month. So by now, I sure hope it's on everybody's calendar. Lisa Tunley, correct me if I get this wrong. I think we are set for November, is it the 12th?
Yes, the 12th. Yep.
So
9
that's just
4:30.
right. Yeah. A little less than a month. And this go around will be in Oklahoma City. We're doing the student union. So those that were around long enough for pre-COVID learning sessions, you're familiar with that building, I hope, in that room, but we're back in that location for this this round of learning session. I'm going to put on the screen the agenda, just so there are no surprises next month. You know what to expect. Although, fair warning, we do have a few surprises embedded in the agenda. Let's see. All of which are meant to induce fun, though. So that's allowed, I hope. We'll start at 9 a.m. per usual. I have a few brief welcoming comments for you. We will review the ProQual data that we have collected to date. And as you'll see further down the agenda there, we're actually going to collect some more of that data. And that'll be a routine feature of learning sessions for this collaborative moving forward, where we attempt to gather some more ProQual data from attendees and then share that back with you so that we can see how stable those quality of life estimates are over time. Innovation sustainment questions. I'm going to give you an update here in a moment on the LASSO sustainment project. Elizabeth's on today, and she might have some updates too on the early intervention, sooner start related sustainment project. Together, all 3 of us, the LASSO folks, Pilar in particular, myself, and Elizabeth will have some comments, a look back over the year of our sustainment work on care coordination. We'll transition from that to a fun activity, a different flavor of scavenger hunt. We've done a few of those in the past, but this one will be unique, so you won't want to miss that. And then we'll dive right into the PDSA presentations. You see, we'll do 3 before our next break, and then 5 before we break for lunch. Lunch will be later than usual, but we wanted to get all the PDSAs out of the way in that morning session. So 12:30 to 1:30, you're on your own. We'll come prepared with some recommendations of places close by so you can get in and out and fed in time. And at 1:30, we have, I wanted to make sure I plugged, a presentation by our very own LaShonda Stevens-Totome. I don't know if she's on today or not, but she has been thinking deeply about, and we have been discussing as a group, the impact of storytelling, storytelling from clients in particular. And this is something we would like to plant a seed among this learning collaborative group as a potential future change idea. That the crafting of storytelling and then the listening, hearing, and reflecting on storytelling of the clients that you serve may be one way that you can boost workforce well-being. So we're going to run through a couple of examples. You're going to hear directly from some clients during that section, I believe. I know we'll have some in the audience that day at least. And then we'll let you get creative with that idea, and excited to see where you take it. If not for the next PDSA, perhaps the one that follows next spring. 2 p.m., another fun activity. This one's not labeled, but I promise it's fun, so there's your surprise in waiting. Lisa's going to go through a little bit of SMART Aims training. One of the things that we've been discussing as a group is doing some refresher training on the CQI process, hearing every learning session, but particularly from newer home visitors, that this is a wonderful idea. And they're a bit overwhelmed at times with the learning session format and hearing new lingo and sort of trying to tie into the process that many of you have been a part of now for several years. So this is our attempt, one of our attempts to try to provide some refresher training, particularly those that are newer in the home visiting role. Another break at 3, we'll come back from that and do our usual breakout groups where we concentrate on the development of your next PDSA. We're really just hoping that we can solidify your SMART aim, have some discussion about the change theory diagram and how that motivates or inspires the SMART aim. And then we'll do some share back. So really brief, but we'll end the day with that so that everybody knows what the next change idea and SMART aims look like for your groups. And we will then conclude. The other thing I wanted to mention before abandoning this agenda is the coming up piece at the very end. You'll notice there's a bit of a gap. So November 12th is the learning session. We will not have rounding calls. We will not have a monthly call in December because of the holidays and the shortened month, but we will come back in January. Your first contact with our group will be through the rounding calls, and then we'll have a monthly call mid-month or maybe even the third week of January.
We will have rounding calls in November, though.
We will have rounding calls in November. That is correct. So we were hoping to squeeze as many of those in as we can, even though the learning session falls on that date and we start with one of the major holidays. So we will get those done, and many of you will get a chance to reflect back on your SMART aim and change theory idea. Change theory diagram if your rounding call falls after the learning session. So brief break in December, but back at it in January. I think
we're going to plan on starting the new PDSA cycle about 1st of February. And how long will that cycle last, David?
Well, I defer to the groups to decide when you want to start. It would be perfectly acceptable to leave the learning session and start, that very next day if you feel prepared to do that. We anticipated that's likely not going to be the case for many of you, and that it may not make sense to start a new PDSA with the shortened month that follows. So January would be a reasonable start date. If there's a compelling justification for waiting till February, we certainly would support that as well. But we do recognize that there's probably not as much CQI work to be conducted during the latter end of November and
how long will this cycle last?
Well, we're still aiming for the 6-month period to stay on track with the 18-month collaborative. So okay. I'll have a better answer for you when we get together on the 12th, but we're still shooting for somewhere in the May area for our next learning session.
Okay, thank you. Would you like to share why I added a farewell and good luck to the end of our agenda today?
I would like to do that. Before I get to that, I had one more thing I think on my list. Just
okay.
I promised Pilar I was going to do my best impression of her coordination efforts here. So she sent the numbers for this month for the LASSO referrals. I wanted to share that back with the group, and pleased to report that it was a very active month. So I want to key your eyes into this column here. This is the month of September. And we had 3 new referrals from the OKC agencies and 7 from Tulsa. All told, over that quarter 3, which is now in the rearview mirror, we had 11 from OKC and 12 from Tulsa. So very active in getting clients referred to LASSO services over the summer. And of course, they're still funded and eagerly awaiting more referrals. So if you have clients, please send them to Pilar. She's on vacation. We insisted she not hop on today's call, even though she offered, but I think she's back in the office next week, and there's an alternative plan. So please keep sending your referrals there, even if they come up this week. Okay, I did want to acknowledge what I called a bittersweet moment just yesterday in an email when I was first informed. We are saying goodbye to one of our longtime Learning Collaborative members. I see Dave is on, and I don't know if Kathy is on here, though. I was looking earlier and I didn't see
She
her.
is, and she wasn't able to join today.
Okay. So I see some people gasping and some people nodding their heads. So I think the word is out. I don't know if the whole group knows, though, but Kathy has announced her retirement. And
Kathy Sullivan. Kathy
Yeah.
Sullivan.
Kathy Sullivan,
Tulsa
yes,
City.
sorry, Kathy Sullivan, C1 Tulsa, announced a retirement for November, mid-November, I believe, November 20th or
Yeah,
so.
the 20th will be her last day. And she wanted me to tell you guys thank you so much for sending her emails and recognizing her 35 years in public health. So she did receive those and is thankful. So
Yeah, so a major champion for home visiting and early childhood in general, and she will definitely be missed. I see lots of sentiments to that effect floating around the virtual room here. We will not be able to tell her this in person at the learning session, which was the email we received yesterday. So I think the transition has begun towards retirement, and she's starting to step away. But if you get a chance to send her an email, or you happen to be on another meeting with her, hopefully you get a chance to say farewell and good luck and congratulations.
and I
If
will
you don't
pass
have,
on all your good thoughts to her.
if you don't have her email at handy, you can open this meeting invitation and look for Kathy Sullivan, and it'll be there. So
Yeah, I can put it in the chat if you'd like.
okay. Yeah, Kathy has been quite a champion of home visiting for many years, and she has made big contributions, brought a lot of common sense and kindness to her work, and we deeply appreciate that. And I know you all do. Join us in wishing her the best of luck.
Yeah, well said.
All right. Thank you all so much. I'm going to stay for just a minute so that if anybody wants to copy that email from the chat, we don't cut it off too soon. But thank you, everybody. And y'all have a good afternoon, and we'll see you at the learning session.